Welcome back to West Texas View.
One of the implications for the first two segments of the program is that mental health that goes untreated is just like anything else. A bad cough that goes untreated, you're affecting all of those people around you. And so the sooner you get help, the sooner you get a diagnosis. It may be as simple as something like medication that helps a chemical imbalance. If I'm not saying this right, correct me. But it might be something that you need more psychological therapy. And so one of the things I want you to talk about is the implications to society when things go untreated, because either we have a lack of psychiatrists that are in an area, or that people just still don't know who to go to.
Yeah, that's a very important point. Again, you raised multiple points in your short statement over here. The first is to understand the fact that the more longer these mental illness or mental symptoms are not treated, the more complicated becomes. Why? Because mental illness not only just stays as mental illness, it tends to affect other systems of your body. For example, there's a study that we have found that patients who suffer from depression, for example, are very much at risk of developing heart problems, cardiac problems, very much at risk of developing diabetes, and a lot of other medical illnesses that may not have developed if you had not developed depression. So they're all interconnected. And just like any other illness, as you said, that the longer you have a cough, and the longer you have a virus in your system, the more you are spreading around and affecting other people. Depression, of course, is not infective. True, it's not something that's a communicable disease, but I think it affects people around everybody.
Because of your actions,
because
or
of your actions.
withdrawal.
Yeah, and because you are still in a part of society. If you are a parent, it will affect your children. If you are an employee, it will affect your employer and your colleagues over there. It affects everybody.
And one, of course, the glaring ways is when it burst out in gunfire in a movie theater, or where a son goes in and kills his parents, or some really horrible things like that. But there are other ways where parents just worry about their children, but they don't know where to go to get help.
Right, and this is something important that people think that if I'm not feeling well, then the only thing I need to see is a psychiatrist, and that creates a problem. Yes, maybe that may be the best option, to see a psychiatrist, but what I recommend is to get your foot into a door to see any physician. Nowadays, the treatment for depression and those kind of early mental illnesses have become so easily available, and most physicians are trained to address basic first-line intervention, or at least they can direct you towards the right resources. So getting to see any doctor, not even a doctor, even a therapist, a counselor, can go a long way. Even a small bit of counseling can be immensely helpful. And this is shown in a study found that people who suffer from depression or suicidal ideations, when they go into counseling, even for a short period of time, the risk for committing suicide is reduced by almost 1/4. 26% is reduced. So what I'm trying to say is that realizing that something is not going well, just don't sit on it to hope that everything will get better by itself. Usually it does not. So to get some help, doesn't matter to see a psychiatrist, get to see anybody, any physician, any clinician, any therapist, any counselor, even your pastor can be a good source of some help, because things start rolling better once you get your foot into the door.
And they begin to help and be your ally.
Your ally, and if nothing else, they can direct you towards the right resources, or at least initiate some form of treatment so that the suffering and the pain, which doesn't have to be that much, can be addressed.
But one of the things that you said was sometimes you have to wait in this area 2 months to get an appointment. And so what if a internist called you and said, I have a patient that I really, really think is having some mental health problems? How quickly can you see them? Do you have an emergency process?
Well, that's one of the things that we have. Of course, if a colleague calls me and says that this is a patient I need to be seen very quickly, I would go overboard and try to accommodate the patient any way I can possibly can. For this reason, both the Medical Center Hospital and the Midland Memorial Hospital, we have started a telepsychiatry service. So basically what telepsychiatry means is that if they're in the hospital, for example, I may not need to be there physically, but through computer and new technology, I can review the patients very quickly and have them seen. We ourselves have started a telepsychiatry service in Texas Tech to see those patients who are overflow, who are not able to get to see immediately through telepsychiatry. True, it may not be as comfortable as a real life seeing person, but most research has shown that the quality of treatment, either through face-to-face or through a computer, is not very different. In fact, there's no comparable difference at all.
It's like as a doctor, you're Skyping your patient.
Exactly, exactly. That's exactly a good analogy. And the thing is that, yes, it will get you in the door, it'll get you the help very quickly, and it'll allow you to change, you know, give you, if you have enough time, maybe down the road, if you want to see a psychiatrist face-to-face, you can always change. But I don't think you should wait for that long to get to see a psychiatrist face-to-face.
And even you can discern through the medical visit that really what they need is a psychologist.
And very likely that a lot of times you may just need a therapy session. Not everybody needs medications. Not everybody needs to be hospitalized. Not everybody needs to have a very heavy doses of medications. A whole lot of symptoms can be addressed by just talking or going through counseling.
Well, one of the things, I know that this doc in a box, as it was originally termed a long time ago, when it very first started, has shown much promise. We're going to have to end this program today, but we haven't even gotten to the questions that people have called in after his last appearance. And so we're going to ask Dr. Jain to come back next week, and we're going to continue this conversation and go to the questions that were asked. We'll see you next Sunday with another program. Thanks for joining us today.
Thanks for joining us for News West 9's West Texas View with Johnny Lou Avery. This has been a public affairs presentation of KWAB-TV and KWES-TV.